Hi, I'm Margie Dangerfield. I'm a registered nurse, midwife, and independent Zeno partner. And I've helped almost 3,000 people using Zinzino's personalized test-based nutrition. In this video, I bring you an industry leader, an expert in their field, who is integrating Zinzino's test-based approach in their clinical practice. So if you're ready to move beyond guesswork and elevate your patient outcomes with our precision-driven strategies, you're in the right place. Well, welcome everyone, and thank you so much for joining us. I'm truly grateful to have you here and really appreciate you taking the time out of your evening or morning, wherever you're tuning in from around the world. It gives me great pleasure to have with us tonight on our Wellness Wednesday webinar. We've got an amazing person to talk us through the work that he is doing, and that is Dr. Oz or Osvaldo Cooley. Thank you so much for joining us, Oz.
Thank you very much for inviting me.
You're welcome. So I'd like to introduce Dr. Oz before he kicks off his presentation. For those of you who don't know, Dr. Osvaldo Cooley is the founder of the Elite Hub Body Contouring Clinic, which is a cutting-edge facility here in Australia, in Queensland, and it blends recovery science, metabolic testing, and non-invasive body transformations for everyday people and elite performers. So with over 2 decades of experience in exercise science and metabolic performance, Osvaldo has a PhD in anti-aging medicine and specializes in high-performing individuals, especially women and athletes, optimizing their body composition, reducing inflammation, accelerating recovery, and achieving long-lasting health improvements. He's also a contributing writer for Brainz Magazine, a speaker, and a passionate advocate for redefining what true health and longevity look like in the modern day world. So thank you, Osvaldo, and I look forward to your presentation.
Thank you very much. The title of this presentation is From Fatigue to Fitness. So basically, to translate this is we're going to be talking about a different way to understand what recovery is. Because working with athletes and working with any kind of person, like if we talk about athletes, if we talk about people who wants to lose weight, or people who wants to just improve their wellness, their overall health in terms of longevity, the one thing that most people do it wrong is recovery. So today, the main thing of this is to see all the different aspects that are going to contribute to have a proper recovery, so your metabolism can work on an optimum level. Okay, so we're going to talk about five different pillars that I usually work with. Five things that we do every single day, but we're just going to find a way to do it better. Okay, so I always like to start, if I'm talking with business people, if I'm talking with athletes, if I'm talking with any person, like with a mom, with a dad, what is your most important asset? And the answer that I usually expect to hear is you. You are your most important asset. If you have a business, if you run a business, you are the most important aspect of that business. If you are not okay, if your health is not okay, that business cannot run, cannot grow. If at home you are your most important asset as well. If you are not healthy, if you are not performing properly, then that home cannot be 100%. So that's the main thing I want people to understand is you are the most important person in your life. Even if you have kids, if you have partners, if you have family, anything, you are the most important because you put in the time and the effort to feel okay, to recover and to be and to optimize your health is going to help you to optimize other people's health and other people's lives. So it's important to put yourself first, not in a selfish way, but in a way that you shine and you can actually become that role model that we want to be to our kids, to our family, to our friends, to our co-workers, etc., etc. So one way to see how optimum your life is, how optimum your health is talking about productivity. And if you go to the dictionary, to the internet and look for what productivity is the measure of how efficiently resources are used to achieve a desired outcome or output, which is a good definition. However, I like to change that just by one single word, and I put the word meaningful. So, productivity is a measure of how efficiently resources are used to achieve a meaningful outcome or output for yourself. So, and in this case, I want to put this term of productivity in regards of your health. So, how can you be more productive in terms of getting your health to an optimum level? So that has to be meaningful to you, okay? So if I ask you, if one day of your life you have been productive, like even one day of your life, like not every single day, but if I ask you, have you been productive at least one day of your life? Most people will say yes. Like at least one day I was really productive, and then after that, I procrastinate, or I feel tired, or I feel whatever thing happens there. So what makes you to be productive one day and then the next day not to be productive? There are external factors and internal factors. So the external environment, which is something that we can in some way predict, and we can adapt to that. So for example, if one day you, I don't know, you're planning to go somewhere, like I don't know, you start working at 8 a.m. and you always come out at 7 a.m., but that day was an accident, or that day is raining or something happened. You can predict few things that could happen, but not everything. So you have to adapt. So you can adapt to external situations that are happening in your life to be more productive. But then with the internal environment, you can actually control that one and you can modify that one. So you don't need to predict what is going to happen with your body, because if you are doing the right thing, then you are controlling how are you going to respond to different situations. So and you can predict that obviously things could happen. Obviously, you can be the healthiest person in the world and still get sick and still get an accident and still have something. But it's easier to control when you know exactly how your body is working from inside. So one important thing about being productive and being healthier and recovering better is to know how your body is working from inside. And that's one of the things for example, I like a lot about Cincino. And that was something I was looking for many years, which is, for example, testing your body, testing your levels of inflammation, testing your metabolism. Knowing how your body is working from inside will help you to get more control over your health, over your how your body is performing, and how you actually sleep, how you recover, how you concentrate. So the more you know about your body, the more you know about your inside, the more you can control the outcomes that you're going to have in your life, in your health. So. Uh, so what is metabolism? So metabolism is basically the engine that will impose that productivity. So metabolism is basically every single reaction that happens inside of your body that keeps you alive. Okay, so metabolism starts with how you breathe, what you eat, how you move, how you sleep, how your hormones work. So everything that is happening inside of your body is your metabolism. So it's basically everything that is happening. So it's important to know how your metabolism is working, to know how to be more productive, to know how to overcome different situations, how to, for example, if you want to lose weight, you need to know how your metabolism is working. If you are struggling with health for whatever reason it is, whatever type of health problem it is, knowing how your metabolism is working will help you to adapt and will help you to control more that illness. And part of that is, for example, knowing the levels of inflammation that you have in your body. That's really important to know how your metabolism is working. The more inflammation we have, the lower our metabolism is going to be. So it's really important to know how your body is working. There are different ways to know that. As I said, one is knowing the levels of inflammation in your body. that helps. Knowing the levels of free radicals in your body. The one that I like the most is doing a breathing test where we do either active test when you do the test while you are exercising. So that's called also VO2 max. That tells us exactly when you're exercising how much oxygen your body is absorbing and how you're using it to metabolize and to use carbs and fat as energy. But we can also do this same test when you are resting, and that will tell us how many calories you are burning, how much calories you need in your body to keep, like, for example, if you want to lose weight or if you want to improve health in general. So, again, knowing your body to me is one of the most important things if you want to be healthy. Now, studies have shown that when you know your inside, when you know what is happening inside of your body, give me just 1 second because I can see. Okay, yes, 30%, like your your efficiency to do things like at work, at home, etc., will increase by 30%, and you will increase by 20% your overall productivity at work. So, knowing exactly how your body is working and having an optimal metabolism will increase your probabilities of being more productive, to complete more tasks, and to recover faster. So, no, this one doesn't look very well. Anyway, so when you optimize your metabolism, you get more focus, you can concentrate better, you get more mental clarity, you can control more your mood, and again, you increase your overall performance, even if it is athletic performance or fitness, or performance or overall performance in terms of work and any other type of activities that you have. So really, your metabolism is going to dictate how your body is working and how you actually can perform in terms of most of your activities. So the main or the 5 pillars that we work with in terms of creating an optimal metabolism and to have an optimal recovery are 5 things that you do every single day uh, in life, which is, oh, sorry, I lost my presentation. So how do I do it? Yeah, sorry. Just going to make this. So number one is nutrition. So I'm not talking just about diet and what you eat. I'm talking about nutrition, which is the difference between diet and nutrition. Diet is what you eat, nutrition is what you absorb. So, it's more important what you absorb than what you eat. And here is really important to talk about different types of supplements, because not all the food that we eat is going to give us all the nutrients that we need. So nowadays we need supplements, natural supplements, to help us to get the our optimal nutrition in terms of getting our metabolism working properly. Exercise doesn't mean just exercising, going to the gym or running. It's any kind of movement that you do will count as it will help to improve your metabolism. Hydration. So we know that we need to drink water. We drink water every day. So we just need to know how much water we need to drink according to our activities, according to our body weight, etc., etc. Recovery itself, here I'm talking more about active recovery, not just sleeping. Sleeping is a very important part of our recovery. However, is how you build your day to get to that sleeping is really important. So how much, like if you get to sleep and like maybe you're going to sleep 10 hours, 8 hours, 10 hours. But if you are too stressed to go to sleep, that those 10 hours are going to be maybe just give you just 1 or 2 hours of quality sleep. Maybe you go to sleep just 5 hours, but you have done enough work during the day to recover from stress, recover from physical stress and the things. And then from those 5 hours, you get 3 or even 4 hours of deep sleep. So you will recover even better than sleeping the 10 hours. So it's really important how this active recovery happens. And going back to athletes and most of the people that we see here in the clinic, this is the main point that most people neglect. Like we think that just sleeping is enough. We live a very stressful life. We live a very fast life when we don't stop, when we work a lot. Um, and That's just not going to help you to recover enough to get your metabolism in an optimum level. And the last one is something that we do every single day, every single minute, every single second, which is oxygen, breathing. We breathe every day, but we don't breathe properly. We don't have the right posture. We have some of us have like one of, for example, of the tests that we do here is a 3D scan. And with that scan, we can see the posture of of our patients and see how that posture is actually affecting how much oxygen they're getting. Just to put it into perspective, when our lungs have a capacity of 500 mils of oxygen, that if we do a deep breathing, like 5 seconds in, 5 seconds out, that will give us around 500 mils of oxygen. In normal conditions, we just give 50 mils of oxygen to our body. That's per breathing. That's 10% of what we need. And we run like that for the whole day. Sometimes we spend seconds without breathing. Like now that I'm talking, I'm not breathing all the time. So that's not giving enough oxygen to my brain, not enough oxygen to my organs, not enough oxygen to my skin, to my tissues, to all my system. So breathing is another thing that we neglect a lot because we say, "Oh, I'm alive, I'm breathing." It's not like that. So I'm going to go through each one of these points to explain you how to optimize all these things so you get your metabolism to the top, and then you can recover better, and then you can perform better. So the first thing is nutrition. As I say, nutrition is not just diet, but if we have to talk about a diet that I recommend to most of the people, again, it depends a lot on your levels of activity, your levels uh, of what are you doing in terms of, for example, an athlete that is trying to train for a competition when they need to build a lot of muscle. Maybe I will go more with a more a high protein diet. However, an anti-inflammatory diet, and this was explained by Dr. Sears in US. Um, this is still good for athletes because it's high in proteins, but the main focus of this diet is on fermented fiber. Where is the fermented fiber? All the green vegetables that you eat. That fiber is going to go to your bowel and help your bowel to work better. So it's going to help your bacteria to be healthy. It's going to help your bacteria to create the mucosa that is going to help the cells in your bowel to close and avoid toxins to come in, and it's just going to help you to absorb real nutrients. So that's going to start helping you to reduce inflammation. However, as I said before, it's really important to test your levels of inflammation because that will tell you how damaged in some way your bowel is as well. So it's not just to see, okay, how many omega-3 and omega-6 you have in the body. It's going to tell you in some way how much work you have to do with your bowel. The more inflammation you have, the more that bowel needs to be fed properly. So it has to be focused on fermented fiber, as I say, all the greens that you can find, um, adequate in protein intake. The reason why is because you want to be eating small meals uh, like often, like your body needs fuel every 2.5 to 3.5 hours. So you need to be eating small meals every 2.5 to 3.5 hours based on green vegetables plus some protein. The protein is really important because again, that's going to give your muscles that mobility, that strength that you need. As I say, small frequent meals, low glycemic load. That means with low glycemic index products, uh, rich in omega-3 fatty acids. And here, this is a big problem because there's not enough amount of omega-3 that we can eat to overcome inflammation. Like there's not enough. We have to be eating basically fish 3 times a day, 7 days a week, 365 days per year. And that's impossible because of the level of contaminants that sea products have. So this is where products like the omega-3 Cincino come through because we need those levels of omega-3 to be high enough to reduce the levels of inflammation and to help this diet to be more effective. Obviously, we have to put some more emphasis on whole, unprocessed foods and be balanced on macronutrients. And the best way to know how many macronutrients you need, again, is doing a metabolic test where we can tell you exactly how much you need of protein, fat, and carbs according to your metabolism. But again, if you don't add products like omega-3 fatty acids, supplements like the Cincino ones, it's really difficult to get the amount of omega-3 that we need. I don't want to go through all the anti-inflammatory effect that the omega-3 is going to have, because I'm sure you have had this multiple times here. In terms of how the resolvins and all the hormones are working around inflammation here. So, but it's just important to know that supplements are really important. There are other supplements like I don't usually recommend too much of probiotics or prebiotics, because the best prebiotic that you can have is in your diet. So if you have the right um, fiber given to your body, which is again from this green product, then you don't need to have prebiotics. And then you don't need probiotics because your bacteria is going to be happy. Um, Obviously, there are situations where you need it, but in normal conditions, just your diet should be enough to feed your bacteria. Okay. The next thing is exercising, so or moving in general. So this exercise has to be tailored to your goals. Like if you are planning to do a competition, like if you are someone fit and you want to compete on things like now we have competitions like High Rocks or Ironman and those things. Obviously, the type of exercise that you need is completely different than someone who's trying to lose weight. So we have to optimize that according to your again how your metabolism is working. The best way to do this again is knowing how your body is working from inside, getting to know uh, what are the like we call it training zones. And just to give you a quick, I think I have another slide about talking about training zones here, but if not, I'm going to explain you a little bit about this. So training zones is basically how your heart rate increases according to the level of exercise that you are doing. And according to that is how much fat are you using as energy. And at some stage, when you are in zone like at a certain level of heart rate, you switch from using carbs, so from using fat to start using your carbs. And then it's when you are obviously increasing more the intensity. So we have 5 zones that we work with. Is zone 1 is basically a recovery one. So it's when you exercise just to recover. Usually that zone 1 is also the zone where you are using more fat as energy. So it's good for fat reduction. Then we have zone 2, which is more for endurance. So people who wants to increase their fitness levels, zone 2 is the best one. At the same time, in zone 2, you burn not as much fat as in zone 1, but you burn enough fat to also help you to reduce weight. So, for example, someone that is trying to lose weight, knowing their training zones is really important, because I get a lot of people here saying, I go to the gym, I get into the treadmill and I run and I sweat a lot, but I still don't lose any weight. Well, many things happening here. So number one, the exercise that you're doing is almost sure not for you, because you might be going all the way to zone 3 or zone 4 that basically you're burning carbs, not fat. You want to burn fat, you have to slow down. You have to maybe walk fast, and that's enough to burn fat. But if you want to increase your fitness, then you have to go all the way to zone 2. If you are more like an athlete and you want to improve performance and improve your oxygen absorption and the things, so you can perform in long type of in really high intensity competitions, then you need to get your heart rate to zone 3, 4, and 5. So depending on again what are you planning to do is the type of exercise that you have to do. So for example, to increase longevity, the best training zone would be zone 2. For weight loss, zone 1, almost zone 2. To improve physical performance, zone 3, 4, and 5. Okay, and then the combination of those kind of things. Some people can move too much, can exercise too much. So even just moving, walking on the swimming pool can rise your heart rate enough to help you to burn more fat. So, and that will help you also to recover because you're not getting all the pressure and the gravity from being outside. So the water will reduce that and give you the resistance that the water gives you when you're walking. So that's a great exercise for people who is with like suffering from chronic pain. I put them to walk on the swimming pool as much as they can, and that start helping them with mobility, that start helping them with strength, and that start helping them to start burning some fat. Okay. But the most important thing with anything that we talk here about is consistency. If you do it 1 or 2 days and then you stop doing it, obviously you're not going to get results. So diet, nutrition, you have to do it every day. Taking your supplements, you have to do it every day. Exercise, you have to do it, if not every day, at least 3 to 5 days per week. And again, knowing the right type of exercise for what your goal is and what your body needs. The next one is water. Water is basically going to fuel your metabolism. In normal conditions, we say that people should be drinking 8 to 10 cups per day. That's 2 to 2.5 liters. Again, that depends on many things. This is just the general rule. If you exercise, then is 500 mils 2 to 3 hours before you exercise, and 200 to 300 milliliters every 10 to 20 minutes during exercise, which I usually recommend that to be after 45 minutes of exercising. The first 45 minutes, try not to drink too much water. That's basically the rule. Most people, and mostly when we get into winter, don't remember to drink water. Like we can spend the whole day not drinking any water. So one of the recommendations I give to people is to basically set up your alarm every hour at the beginning until you start getting that habit of drinking water. So you know that every hour that you're awake, you're going to have 1 glass of water. So set up your alarm every hour, and every time your alarm rings, you have a cup of water, which is usually 250 mils, the average glass of water. So, and that if you're awake 10 hours a day, you're drinking 10 cups of 10 glasses of water. That would be enough. Again, that when we do the metabolic test, we also can tell you exactly how much water your body needs according to the level of activity that you have and how your body is actually using that water. So again, it's really important to know how your body is working from inside to get more specific on these kind of things and not just get the general rule. And then active recovery. This is to me one of the key for optimal performance. We take for granted, and as I say at the beginning of the presentation, most people think that just because they sleep 8 hours is enough. Now with all these devices that we get, with all these smartwatches that we can actually measure how much we sleep, you will see that the average person will sleep around 1 to 2 hours of quality sleep per day. That's around 14 hours per week. Yeah, so if you sleep 10 hours, you have to check that you at least get those 2 to 3 hours of deep sleep. Not necessarily the longer you sleep, the more quality you get. To me, it's very important what you do during the day to get to your sleeping. And that means nowadays, we have a lot of recovery clinics everywhere, like P3, what's the other one? City Cave and few other ones that are there. Some gyms have also those recovery things. It's really good to try them and try to do that at least 2 or 3 times per week if you can, at least half an hour. Do compression boots that are going to help with lymphatic drainage. Do sauna therapy. There are different type of sauna. The one that I like is the one is like a capsule, like a cocoon, because that one helps you to absorb the heat, and that actually at the same time that is recovering the muscles is mimicking you doing high intensity exercise without the impact of the exercise. So will help a lot with fat burning, will help a lot with endurance, but will also help a lot with recovery. So one session on the sauna will help you to sleep better. But research has shown that if you do at least 2 sessions per week on a sauna at around 70 degrees, you decrease by 10 times. After 3 months, you decrease by 10 times your probabilities for any chronic disease. So that's a good thing to do. So try to make it a habit. If you go to the gym and they have a sauna, again, the normal saunas that look like a cabin, they're not my favorite ones. I think the cocoons are much, much, much better because they give you more things. But if it's not available and there is a normal sauna, try to do half an hour, 2 or 3 times per week. Try to get to 70 degrees, and that will increase your life like considerable and will reduce the probabilities for chronic disease uh, like considerable, like a lot. Um, the other thing that I recommend is contrast therapy. Contrast therapy is hot and cold therapy. So it's a combination. You remember when you were a kid and you maybe twist your ankle and it was swollen, and then they say, okay, put it on cold and hot and cold and hot water. Basically, contrast therapy is the same thing, but for the whole body. So most of the recovery centers have these ice baths, which are really uncomfortable and difficult for most of the people to get there because it's really like the most you can get in there is maybe 4 or 5 minutes. And it's basically mostly athletes the ones who are using those type of ice baths because it's for normal people is really uncomfortable. I said, for example, my wife, we went to P3, which is one of these centers, and she couldn't get to the cold. They have four different pools in there. One super cold, the second one less cold, then one warm, and then hot. That like really hot. My wife couldn't get to the cold ones because she said, no, it's way too much. I can't. So she couldn't get the benefits of getting into a cold therapy because how intense that is. What we have here at the clinic are these chairs that they get cold and warm. We can regulate how cold they get. So we get people that in normal conditions won't be able to do cold by doing it like really low and then start increasing like the intensity of the coldness of the cold therapy. And they start getting used to it. And because you're with your clothes and the things, you don't feel it that much, but you still get the benefits. So I really like those ones. And then we combine that a lot with the sauna. So get people to do sauna, cold therapy, and you can actually be more than the 4 minutes that most people can't tolerate on the ice baths. So you can actually be 15, 20 minutes on cold without feeling that is just freezing you. And in hot weather, it's even much, much better. And if you have exercise, it's even better. So you feel really, really nice. And then by doing all these things, your quality when you sleep is going to improve at least 10 times. We get a lot of people here that they come because they want to lose weight. They come because of chronic pain and the things. And one of the main things they tell us after 2 weeks coming here is I can't sleep, but like I'm feeling my sleeping is changing for good. Like I'm waking up with more energy. I feel I'm not waking up at night or things like that. So I feel more active in the morning. I feel more active during the day. So getting that recovery is really important. And as I say, this is the maybe the one thing that most of my patients will neglect. Um, Taking time for yourself and recovering and doing things for your body to optimize their functions. And then the last one is oxygen. Oxygen is something we do every single day. That we breathe every second. That's why we're alive. The problem is that in normal conditions, the oxygen that we have in the environment is just 26%. And from that 26%, like most of the environment has other gases like nitrogen, hydrogen, and the things. So oxygen is just 26%. So we're allowed, like our body is just breathing 26%. And as I said before, we just breathe about 50 mils of oxygen per breathing. So that 50% is just from the 26% that is in the environment. So it's really low the amount of oxygen that we breathe, um, uh, like in normal conditions. Uh, but Why is oxygen important? Basically, because everything in your body needs oxygen. Like our body is made 70 to 75% of water. If you remember the formula of the water, it has oxygen. So we need oxygen to get that water moving. We need oxygen inside of the cells. We need oxygen inside of the organs. We need oxygen for the brain. We need oxygen for the skin. We need oxygen for everything that happens, every function that we need in the body. The less oxygen you have, the more tired you are. The less oxygen you have, the less you can concentrate. The less oxygen you have, the less you can, or the less quality when you sleep. So oxygen is really important because oxygen will accelerate our recovery process. The more oxygen we have in the body, the more our cells start recovering and getting healthy again. So one thing that we recommend is hyperbaric chamber. So what is a hyperbaric chamber is a chamber, as you can see there, like a spaceship that you get in and it inflates full of oxygen. So the environment there is 100% oxygen. The difference with the environment, again, is from 26, you go to 100% of oxygen. And because the pressure is high, it has a high pressure, which is 1.3 in case of this. Most of the chambers, most of the commercial chambers are 1.3. They go all the way to 2 or 3 atmospheres of pressure. This one is 1.3. Research has shown that just with 1.2 atmospheres, the absorption of oxygen increases all the way to 90%. So instead of just absorbing the 50% of that 26 oxygen that we have in the environment, you are on an environment in that chamber that is 100% and you're absorbing 90% of that. So that's a boost of oxygen to your body, to your whole body. So that will increase the oxygen delivered to your whole body, will accelerate the healing process of your cells, of your organs. So we use this a lot for people with chronic disease, chronic pain. Research has shown the benefits of using this on patients with dementia, with cancer, some sort of cancers, not all of them. There's still controversy with lung cancer, but some other cancers like prostate cancer, skin cancer, breast cancer have shown a good outcome. It will reduce the levels of fatigue. So you come to the chamber, you come out from the chamber feeling energized. It will boost your immune system, will improve your brain, like it's going to get, as I said, we get a lot of corporate people coming, having a session there just before an important meeting. So they get all this boost of oxygen to the brain, so they get more sharp, more mental clarity. It helps a lot for athletic performance. Again, you need oxygen to get your cells recover, so muscles recover and the things. So athletes get injured, get pain, get sore because of the high intensity or high levels of exercise that they do. So they recover faster, uh, and they will increase your lung capacity. So by doing regular sessions on the hyperbaric chamber, you will start breathing better. So you, even with just the 26% of oxygen that is in the environment, you will actually start breathing better and absorb more instead of just 30 to 50% of that oxygen. You're going to be able to start increasing that to up to 70 to 80%. So even outside of the chamber, you're going to start breathing better and getting more oxygen to your body. So it's really important. What we recommend, like there's a lot of places that say that you can do hyperbaric chamber every single day. I I don't recommend that. My protocol is 3 days a week. That's what research has shown that is 100% safe. More than that, there's not proper research showing of the how safe it is. So you don't want also to put that much oxygen in your lungs because then that oxygen can become water and you don't want to get fluid in your lungs. So that's why to me, 3 sessions per week is more than enough. It's really difficult to do 3 days a week, like you need the time. So even if you do it once a week, it's accumulative. So every time you do it, it's going to start getting better and better and better. So even if you can do it just once a week, 45 minutes to 1 hour is more than enough. And that's basically it in terms of this presentation. I don't know if it was too long or too short. Um,
No, that was fantastic. Thank you so much, Osvaldo. And for those of you who are in Queensland and close by to Osvaldo, I've actually been to the health hub and the elite, your elite hub actually, and it is amazing. So you've got some incredible equipment there, and yeah, you're actually seeing some phenomenal results. And I just love the fact that you're incorporating the Zenzino balance oil, as you said, how important that is for your clients as well. And you're getting them tested as well.
Yeah. And yeah, no, that's part of our protocol. Our protocol has that I start with almost everybody. Again, it depends obviously budget and times and few things, but basically anyone with chronic pain, chronic disease, that's the one thing that we have to do with all the patients. We do, as I said, the metabolic test and the inflammatory test are our priority. Mm.
Fantastic. Well, thank you so much, Osvaldo. I am really,
Actually, on this first picture on the left,
yes.
you see me talking with someone, that's actually you.
Oh, here on the left. Oh,
Yeah.
there you go. That must have been that information day that
Yeah,
you,
yeah, yeah. When we did the open day, yeah.
yeah, fantastic. That
Mhm.
is amazing. Well, I will open it up for questions now, actually, if anybody does want to ask about Osvaldo questions. But that was such a good explanation and an interesting understanding of all the therapies that you're doing.